we are looking at the most important element for diagnosing reading difficulties. First of all, we know that struggling readers are not the same. They're not standardized product. One size fits all does not work. There are three deficit areas students can struggle in: one, two, or all of these: word identification, fluency, and or comprehension. I find the diagnostic reading assessment of some type or an informal reading inventory the only, if not the best way to get at diagnosing the cause of the reading difficulties in one of or all three of those areas. It contains a miscue analysis, so you can see the types of miscues and strategies students are using, gives you a sense of comprehension. There's usually a comprehension question or a retelling chart of some sort. And then fluency, where you're actually listening to the student read. You get most of your information by listening, but also you can time these and get a words per minute rate. So I find the diagnostic reading assessment probably the best. However, what is missing in this diagnostic picture? Think about it, think about it, think about it. Yes, the student. Could you imagine a doctor diagnosing a patient and not asking that patient, tell me about it. What are the symptoms? What do you feel? When did it happen? But yet that's what often occurs with struggling readers. Doesn't have to be difficult. Understanding the reader, you can stop and think about this. I would usually include 1 to no more than 4 questions. What makes reading hard for you? What kind of things do you like to read? Tell me about your reading. That's usually the best one. What do you do when you don't recognize a word? You don't understand. All right, one of those. What makes reading difficult for you? As well, there's a variety of reading attitude surveys. You can use something like this and design your own, of course, or you can find a variety of them online. Younger kids, older kids, something like that, or you can design your own. The thing about both of these, you can use them for progress monitoring, both the open-ended questions and the rating scales. Progress monitoring, showing change over time. Every 4 weeks or so, I would probably give something like that to see if there's any change over time. Does not have to be complicated, people. Keep it simple. Simple ideas are usually the best.